Hey everyone, Dr. Charlie Johnson here, physical therapist. Wanted to shoot a quick video to help people better understand how they can do simple body weight exercises at home, and specifically how to do a push-up. And maybe instead of properly, I should have said more optimally, because it depends on what you're trying to do, which muscles you're trying to work, a lot of different things. So it really depends on, just remember, like people say, like, what's the right way to do this? Well, it really depends on what your objective is behind that exercise. But anyway, you know, the normal push-up that you see, I want to kind of explain how we can best do that so that we don't hurt our shoulders, our neck, our back, things like that. Because what I've been seeing is I've been seeing a lot of people on social media, which is good, don't get me wrong. I want people to be active, but I also want them to be healthy and not hurt themselves. Doing this whole, like, what's it called? Get 10, give 10. Which I think is like a push-up challenge or something like that, where you do 10 push-ups or someone nominates you to do 10 push-ups and then you nominate somebody else to do 10 push-ups. But what I've been seeing is a lot of this, which is a specific way people are doing push-ups that I often see bothers people's, specifically their shoulders. So again, I'm not saying it's maybe right or wrong. I'm just telling you my experience when I see people have shoulder pain, specifically shoulder pain, sometimes neck pain while doing this exercise. This is the common fault, and this would be my recommendation to people. So here we go. So here's what I'm seeing when people are doing push-ups. Pay close attention. Here's the way that people are doing it that often leads to shoulder pain, rotator cuff problems, neck problems. Here's what it looks like. So this is sort of what maybe to avoid or maybe try to tweak, all right? So from the side view, all right? So when people are doing a push-up, they're here, and that's fine, they start fine. But when they do it, the angle of the elbow, so you can see that my elbow is coming right at the screen. So the angle of the elbow is high up at the shoulders. So the pushing motion is like this when I'm seeing a lot of people doing these push-ups online. From another angle here, this would be, so their shoulders are kind of rotated in, and the elbows are flared out, and then they're pushing down like that. So they're coming in a high, kind of a high elbow position. And a lot of times that will increase stress on the shoulder joint, because the shoulder wants to pop forward. And we know that when the shoulder is in a rotated inward position, the shoulder generally doesn't like that. It creates less space within the joint. It's not an optimal position for the joint, I guess you could say. So therefore, a lot of people are doing this. They end up with shoulder, rotator cuff, all kinds of different problems within the shoulder, and or a lot of strain on the neck. It's not to say you can't do it like that, I guess, but if your objective is to do it safely and to strengthen your chest versus stress your shoulders, then there's probably a better way to do it. So that's the first thing there. And, you know, why are people doing it like that? Probably because the shoulder or the push-up is too difficult. So they're like, oh yeah, I can do push-ups. And then they're cranking out these push-ups like this. 1, 2, whoa. I don't know, that doesn't seem like a push-up to me. So I'd rather people go through the full motion and be able to do it effectively without hurting their shoulders, tearing the rotator cuff, all kinds of different things like that. So how can we change that? So first things first, if it's too difficult, we can regress that. I'll give 3 simple ways that we could change how we do the push-up to make it easier, but maybe you just need a tweak of form. So again, notice that I try to move it closer here. That the one thing I said people were doing is they were flaring their elbows out and doing this, right? Look, men do this. I see a lot of women doing this, so sorry if that offends any women out there, but it could be because the push-up is just maybe too hard, and or that's just the form that they default to, but maybe they just need to know the technique. So one thing to do is instead of kind of having the hands like this, face them straight forward, and instead of having the elbows up and out, suck them down. So that here's how I would recommend not doing it. Here's how I would recommend doing it. See how I kind of lock my elbows? And like this. So then you can do your get 10, give 10, and the shoulders are in a very neutral position. They're not winging out like this. So from the front, it would look like this. Here's how people bother themselves, like this. Suck the shoulders down. They don't have to be by the side. That's like a tricep push-up. Instead, just sit like a 45. So you can see at my shoulder, my elbow, instead of pointing directly out to the side or towards the camera, it's sucked back and it's going back at like a 45-degree angle. So this is going to be a neutral position for the shoulder, and you can crank them out all day like that. All right, so it should be kind of going out and back to the side. If you want to work the triceps more, suck them in and literally go right by the side when you do it. So this is like the elbows are pointing straight back. That's more of like a tricep bias push-up, all right? So if you can do that, that's great. What if you can't do it? And what if the reason that you're able to do that is because, well, it's just too difficult? Well, a couple simple things. So, you could, first off, like if you're in that position, first off, you could just try from the knees. So you can keep a line from here to the shoulders, and you can do it not like this, right? If you make it easier, potentially you can put the shoulders back, make sure that they're at a 45. So you could just go from the level of the knees. So that makes it a little easier, but still kind of difficult. So what you could do is you could just go to your kitchen countertop. From the toes, body still in a straight position, not excessively hollowed or arched, just kind of neutral. And then just hit your chest. Right here. Elbows at a 45, notice they're not up here again. They're back, they're not sucked all the way down unless I want to work my triceps. They're out to the side. And you can just work that, all right? So it's a little bit easier. If you want to go really easy, you can go to a wall. These are stairs to nowhere in my clinic. And I got stuff on the walls here. But point is you could just start here, not here. So people doing push-ups from the wall, if it's too hard, flat from the knees, still too hard from a countertop, you can find a wall and do a push-up. But remember, picture like you had a bar. So imagine you were at the gym and you were working with a trainer and you were going to do a bench press. Well, the bar, you wouldn't have the bar come here and hit you in the head, right? You would have it kind of come here, almost to like the line of, well, my nipples, basically, right? It's like nipple line, I'd say. So right where this button is on my shirt. Right? So if you're going to do it from the wall, think of the same exact thing. So a lot of people put their hands here and they're doing push-ups, but notice if I was holding the bar, that would be hitting me in the forehead. So I don't really want that. I'd have to drop them lower than I would think so that it would hit me in the chest. So that would be a simple way. Again, arms not up, elbows not all the way down, unless I want triceps, just out to the side a little bit. And you can work a push-up there. So that is an option. A nice way, or another way that you could do it, is you could use the level of the steps to help you measure progress. So you could, 1, 2, 3, let's start at the 4th step if you're tall enough. So if you're at the 4th step, again, picture this step as the bar. That wants to hit you right here. Don't hit your forehead when you're doing this, all right? So you could start there. Step number 4. And work your push-ups at that level. As you get a little bit better, go to step number 3. Again, don't let it hit you in the head. You could go to step 2. You could go to step 1. Point is that you could just progress yourself and move lower and lower, which places your body less and less vertical and more parallel to the ground, which makes it harder and harder. And then go to your knees and then go to your feet. So, summary here. See a lot of people doing these push-up challenges, which is great. Everybody's trying to stay active. Get 10, give 10, just push-ups at home for whatever, for just overall fitness and health. A great exercise to work the shoulders and chest and belly and all of that. But a lot of people are doing it with their elbows flared up and out. This is actually a test we do to determine if something in the shoulder joint is irritated. Just like this, we would literally say, do this. And a lot of people get pinchiness in the shoulder. So if you're doing a push-up like that under load and your elbows are high, It's happening either because you just don't understand the technique and nobody's walked you through what I just did, or number two, it's too difficult. So I gave you a couple different ways to make it easier. What were they? Try it just going from your knees. See how you do. Try it going from a countertop. Remember, the countertop should hit you here, right? As if you were doing a press or something like that with a bar. It shouldn't hit you up here. If the countertop is still too difficult, go to a wall. That's like the easiest. Make sure when you do it, the hands come down around this level. The thumb should be right along like chest line. And if that works, great. If you want to be more objective, you want to measure your progress, do push-ups from the steps, and you can start maybe the fourth step up, and then as you get better, go down. So that's a couple different ways that you could make it easier and then build it back up to harder, which is just a straight normal push-up. Technique-wise, rather than being in this position, which bothers the shoulders, you want to pull the elbows down so they're at like a 45-degree angle. They're pointing down this way when you do the push-up. Again, this is a pinchy shoulder for the position, or pinchy position for the shoulder. This is a bit better, but takes a bit more strength and control. If you suck it all the way down by your side and do a strict by the side where the elbows are pointing down or back, however you want to think about it, depending on the position, that would work more the triceps. You can feel more of a burn back there. So hopefully that's helpful. A couple different ways to help if you are trying to do push-ups. You want to use them to stay active and healthy and strong during this period where a lot of us are home, but you don't want to take off your shoulders or your neck. So hopefully that's helpful. This is Dr. Charlie Johnson, 484-552-3767. I'm still here. I'm not accepting patients in the clinic, but I'm helping people online using various treatment methods and movement as medicine, where I'm teaching people to heal themselves. You can reach out directly. We can set something up. And or if you just have questions, comment below. Share this with anybody who you think it would be helpful for. Thanks so much, everyone. Chat soon.